So the only purpose of the bone that we have on the jaw is to hold on your teeth. So for a reason like a decay, gum disease or trauma, if you have to lose a tooth and have the tooth replaced with an implant, it's very important to have a bone graft done at the time of the extraction. Bone is like a muscle. If you don't stimulate it and if you don't practice it, it's going to start shrinking. It's going to go to what we call atrophy. So it is very important at the time of an extraction to be able to place a bone graft into the socket to maintain the volume of the patient's bone, so at the time of the surgery, at the time of the implant placement, we'll have all the bone that we need to be able to place an implant into a perfect position, into a healthy position, into an anatomy that is safe. Bone grafts comes from different origins, as you all know. We have bone coming from the same patient. We have bone that we can buy, of course, from the shelves, coming from human-derived products. We can have them from animal-derived products, or we can have them made of synthetic products as well. So we have a long way, different ways of doing it, but it's very important that every time you take a tooth out and you know that you need to have an implant placed, do a bone graft inside that socket to maintain the bone, to maintain the volume of what you already have, to avoid adding cost, discomfort, and expenses down the line.